to get started, I just want to say thank you to everybody who has joined, and to anybody who wasn't able to join, but hopefully is going to watch this later on. As I said, this is our first Instagram Live, so it could be a bit of an adventure. We'll see, but I think it's going to be a really fantastic conversation regardless. But just to lay the groundwork for what we're talking about today, we're having what I think is a really important and very timely conversation about how Americans are thinking about care work and care workers, and what needs to change in the discourse and in our communications to build a better care infrastructure that supports not just care workers themselves, but support all of us as we go through our various stages of life and as we age. So I will, it looks like iJen might be joining in a moment. So I think we can make sure that she's here. And please excuse the, we are right at 14th Street in Washington, D.C., so we often get a lot of sirens coming by, so I'll just make, pause if that happens again. So I want to say hi and a huge thank you to all of our guests today. You are all really fantastic and impressive change makers in this particular field around care work, and I'm really looking forward to hearing. But just to introduce you all quickly, the first person that I have on my right is Ishita Srivastava. Said it right that time, from Caring Across Generations. We also have Robert Espinoza from PHI and iJen Poo from National Domestic Workers Association. So thank you all again for being part of this conversation. I'm really looking forward to hearing all of your thoughts. So the focus is on, again, on how people are thinking about care work and how we change the discourse and push forward a narrative that builds support for a stronger infrastructure around care work in this country. And just to give you a little bit of perspective on where we're coming from in terms of frameworks, who we are, why we're interested in this topic, is that we are a social science research organization that focuses on understanding how people think about critical social issues and how we create evidence-based communications help create social change and really move the needle on how people are thinking about these various social issues. And so we have actually been doing work on how Americans think about care work and care workers since the very beginning of the pandemic. We actually launched this particular strand of research, I believe in May of 2020 is when we started. And what has been particularly, I think, important and fascinating for us in terms of the findings around how people think about care work and care workers is that care is, and caregiving is something that Americans think of as being an inherent character trait, right? You are a loving, nurturing, caring person on the inside. And that's what's really important when you're bringing, your care into a care work position. But what that does is it obscures the role of professional development, of developing skills, of working conditions, and of wages and their importance in creating better conditions for care work and for care workers. And at the same time, this idea that caring is a character trait and you need to be inherently nurturing it plays into this separation that we tend to have in our minds as Americans between thinking about care, what care is and what work is. And so this idea that you should be doing something for love and not for money. So care workers should be doing the work that they do out of the sort of loving care of their heart. And if they're doing it for pay, they're doing it for the wrong reasons, and they're probably going to do it really poorly. And so this has really important implications for how we're going to talk about care work and building support for a care work infrastructure in the future. And, something that I think all of us collectively realize that we face and are collectively committed to sort of overcoming and navigating around to create a better narrative that leads us to the social change that we're working towards. And I do, just as an aside, before we get into the conversation, the research that we've been doing around care work has been very focused on home health aides and people who work in nursing homes and care work at the end of life. But it's critical that we think about care work in a more holistic way and creating a narrative that helps us build support, to build an infrastructure that creates better care work, a better care work infrastructure across the entire lifespan, including for people with disabilities. So I'll just note that as well. And all of this research has been part of our culture change project that we've been doing for the past 3 years, but we're also doing work more generally on work and labor that is working to kind of make those connections across childcare, disability care, and care for older people. So I want this to be really an open conversation between all of you, but I have some prompting questions that I'd love to hear from each of you on, and then feel free to speak to each other, not just to me. But I think my first question is about, why is this thinking about care workers as being angels, of sacrificing their lives, of kind of even being martyrs, as opposed to thinking about working conditions? Why is that still such a dominant way of thinking about care work in America? And Ishita, I'd love to hear from you first.
I found it really interesting in a study that both those things, there was this idea that, good care workers are care workers who have this inherent personality trait. And then at the same time, there was also a finding that said that care workers aren't really fulfilled in their work. So that was just even that sort of signaled to me just a couple of things that, we're sort of always trying to transform in our culture narrative change work, which is care is, one, just like not valued at all, as it's invisible and it's not valued in our culture, and therefore also not in our policies. And this goes back to sort of, goes back to sexism, this like naturalistic mindset of who is predisposed to care, that cares women's work, and to a very particular history of racism in this country where this was done, forced labor done by primarily Black women in homes. And so I feel, it's, those things still affect the way people think about care today, but they also affect the policies around care, Nigel, and Robert can also speak, of course, much better to that than me. But so I think it's just deeply rooted attitudes rooted in sexism and racism and inherent just devaluing of care as work. Hi, Jen, you want to jump in?
Well, yeah, I was going to say that we have this belief in this country that care is a personal responsibility, a role perform for the people that we love out of the kindness of our heart, or out of our dedication as family members, parents, daughters, and there is sexism underneath that narrative, because in reality, what it means is that the women should hold that and hold it alone, and it's invisible in that context. And what is an extension of that is, if we're struggling with it, that it is also a personal failure. And so it all becomes very individualized and contained in this realm of the private home, the family, and a natural role that is an extension of these relationships. And yet that has only ever been part of the story, right? That it is true that it is a part of a sacred role that we hold as family members, as parents, as daughters, as siblings, as loved ones. And we have always relied on community, on workers on invisible and not, and the fact that we haven't really acknowledged that is just a very deeply rooted set of beliefs, and that is kind of what I think what your study is unearthing.
Yeah, if I can build on that, I want to share a quick story, which is that yesterday morning I took a taxi to a doctor's appointment, and I'm sure others on this conversation have dealt with this, but people ask you what you do, and then you tell them what you do, and they immediately open up about their care story. And what I've experienced are typically stories that are not great. They're typically at end of life, and they typically involve the story of not being able to afford care, not being able to access a worker, like a dysfunctional fraud system, right? Well, he opens up and he tells me about the worker he had during hospice for his mother. And he tells me that he really loved this worker. And I asked, what did you love about this worker? And he said, I love that she was compassionate. And it dawned on me, and I felt this for years, that, you know, care is a very personal, intimate experience. For a lot of us, it can be really crushing if we lose somebody, and we remember the people who had the compassion to deal with us in the ways that are proper, right? But we don't talk about, and it's a very kind of one directional perspective on it, is that we see what did they do for us in my moment of need, instead of asking, like in all relationships in our society, that relationship is reciprocal, like what can I do for that worker as well, right? And I think care allows that. The other piece that I'll throw out, and it's a little more controversial, is that I don't always assume that the reason these messages are out there is because of, you know, kind of a lack of awareness about care work. I actually think sometimes they are intentional. They're designed to distract us from thinking about what does it mean to provide good jobs to workers of all types, but especially to low-wage workers, to workers of color, women, immigrants, and more. And they're messages that are propagated by anti-union busters, by anti-worker advocates, by, you know, policymakers who don't agree in these kinds of job conditions and workforce protections. And so we have in many ways sometimes bought into the narrative, and it's on top of the invisibility of the sector. You know?
And I think because it is such an intimate and emotional form of relationship, that a lot of the realities of the fact that it is a job, it is a profession for millions of workers, it is the way that millions of career professionals pay the bills and support their families.
Mm-hmm.
It all does get obscured, and I think there's a political scientist at Berkeley named John Powell who has this kind of helpful separation between two different kinds of suffering that I find useful in this context. That there is a suffering that is a part of the human condition. There's no question that, you know, we will lose people and grieve. We will go through hardship we'll have our hearts broken. We will have to work hard. And that is just part of the human condition. And there are forms of suffering that are the result of systems that humans designed and therefore can change and redesign. They don't have to exist in this way. And I do think that because of how emotional and intimate and human care and care work is, it's harder for us to see that there are systems operating that we designed that we can redesign and change.
Mm-hmm. I think one thing that comes to my mind when I think about this is, or that always strikes me when I think about this, is the fact that, you know, nurses in hospital settings also provide really intimate, often emotional care for people that we love, but we are able somehow to see the systemic context differently. We are able somehow to see that as a workplace, and therefore therefore we're able to think about work conditions and labor conditions in that context differently than we are in the home. And so just like the idea of this happening in homes and sort of what we consider informal workplaces, I think is also really important to just that disconnect.
Yeah. Yeah, I think you brought up so many interesting things about sort of the emotional connections that we have to words and ideas. You know, what does home mean to us? It's a place where we receive care, and you know, those emotional connections. I think, just as an aside, something that we saw with some work we did on childcare, where we talked to people about valuing the childcare workers in their lives. You know, people talked about, like, well, I mean, we could bake them a cake, right? So that's not the value that's systemic that we're trying to get people to. It's about working conditions. It's about policies and programs. And so how do we get people beyond that kind of more emotional cake baking ways of seeing value to the value of changing the work itself in ways that are more positive, and support care workers. And so that actually leads me into my next question, which is, what do we need to change in our discourse to build public support for those sort of more systemic changes? And I'd love to hear, Robert,
I start
from you
with
first,
so
and
much. I mean,
then
so
from
much
all
needs
of
to
you.
change about our narrative. But a few things that I would change. I mean, one is, I think in my work, the greatest misconception that we see about direct care workers, whether it's a home care worker or a nursing assistant, is that the job is low skilled or unskilled. That again, it just requires compassion in the right person, et cetera. And that because of that, it shouldn't be paid more than barely above minimum wage. And that's a gross misconception. It actually requires significant skill and emotional labor and training. And it should be professionalized at a level that they can earn a salary and they can see a career ladder and so much more. And yet that's just a misconception. The second one is, I do think that there's a narrative that's coexisting on the care work, which is the narrative of the racist narrative of people of color who are exploiting a system and capitalizing on benefits. And it's a narrative that's used by politicians to defund Medicaid, which is the primary public payer for long-term care. So you see this narrative that says, we don't need Medicaid. Medicaid is creating fraud and abuse and people are exploiting it, et cetera. The funding goes away, and then the money goes away from people who need Medicaid for health coverage, for long-term care services, and for good jobs. And I would challenge that narrative as a deeply racist, though probably sexist narrative that is ultimately harming all of us, because we all, if we don't need it now, we will need a caregiver at some point in our lives.
Yep, I agree with that, and especially this idea of care work as unskilled work or low-skilled work, and that if we want to create good jobs, that it's all about upskilling the worker, when really it's about upgrading the jobs and about seeing these jobs as equal to every other job that is contributing to this economy. And I mean, I often talk about the fact that people still refer to domestic work as help, as opposed to the actual full-time profession and career. And if you've ever spent time with a professional care worker, you know that it's like the level of difficulty, like emotional, technical, physical, is just incredibly high. And also the agility required, because every day can be different depending on what the context is. And I was once on a panel with a home care worker who the way that she talked about her day, like a day in the life, and the kinds of things she did and how she prepared and the way that she organized her time and her relationship with her client and the things that she was observing. And I just thought, like, you know, when you see Beyonce perform and you are like, wow, she was born to do what she's doing. I really felt that about Miss Deborah as she was talking, like, wow, the incredible brilliance and genius of what is happening right now is humbling, but we don't see it. Our societal frameworks are trained to devalue some of what Miss Deborah brings. And I think for us to start to observe that, I think, is how we start to shift it.
I'll just pick up from right where you left off, Aiden, and say that, I mean, I think I agree with you, Robert. I think there's like there's like deep-rooted historical and sort of normative reasons, and then there's also intentional reasons why this is sort of obscured from the mainstream. And so from where I sit, I think sort of at scale pop culture interventions where we can actually both sort of center the individual sort of experiences, like Aidan, you just described, of care workers, of the people they're caring for, of family caregivers, but then also pop culture storytelling that connects the dots between those individual experiences and sort of the systemic context and alternate narratives around solutions. All of those things are very possible in pop culture, and I think that unless we are putting those out at scale, we're sort of, it's going to be really difficult just at the sort of level of framing and discourse to kind of actually shift this long term. Of course, that's that's my personal bias. That's the work I do, but I really think that the pop culture piece is critical, and we saw that with, I mean, every story doesn't have to be a Roma or a maid, but centering those experiences actually allows for so much to be illustrated in a way that is totally engaging and completely relatable to all of us. So, and every story doesn't have to kind of be that big a story of a care worker, but there's opportunity at all levels. And I think without that, we're not really going to be able to shift to where we need to go.
So that does lead into my next question, which was about mobilization and about people being able to take action and join this narrative change effort. And so I'm really interested in Aijan, you starting with this particular conversation, especially based on your
I think the movement to change the way we support care in this country is on the rise, growing, maybe exploding. On my best days, I think we're exploding the movement. And I think it's because we've just all gone through so much with the pandemic, and it really brought the inadequacies of our cultural and our policy frameworks to bear, and it exposed how much needs to change. And so I would say to get involved in organizations, supporting organizations like PHI and Caring Across Generations and NDWA. These are organizations that all have a piece of this ecosystem that's really trying to move towards the same place of a more caring and supported future for all of us. And I think to really to be explicit and out loud about your care stories. Ways in which care is a huge part of your life, and a really important part of our future as families, communities, and as a country. And in a way that is about building the kind of foundation in our economy and our culture that will help us through times of crisis and make us more resilient, make us more equitable, make us more humane and human. I just think so much is possible right now because so much got shaken loose in the pandemic, and it's everything from policy change to changing the way that we relate to each other and support each other. And it could also not change, and it's really up to us.
Yeah, I was going to sort of say that, for individuals who don't necessarily think of themselves as having care in their lives, it takes, like Robert said, like a few minutes of thinking about it to sort of realize the relationship that you have to care. So really bringing those stories out but also to a bunch of us who are, trying to do some of the pop culture and culture change work. It's just really important to have those nuanced and authentic stories with us. And then I would say to people who are here listening, who work for other organizations, CARE really connects to all the issues out there in a way that lends itself to really powerful narratives. And so come collaborate with us. I promise you there's a connection to your issue. And it's really, that tends to be the way that the best care stories actually get told. So yeah, that's my ask.
Yeah, I'll probably repeat a bit what has been said, but I agree with the importance of storytelling. And I remember I came of age politically in the LGBTQ rights movement in the late 90s and the 2000s, and it was really critical as a tactic to move our country on those issues because we were so dehumanized. In fact, we still are in some ways. And every time one of us came out, it was a political act, and it forced people in different settings to contend with it and to say, what does this mean about our own sexualities or our own understandings of the world, right? And I do think it's promising in the research that Frameworks has put out that there seems to be a lean towards wanting to learn more about understanding the systems that shape care. And so I do think that those stories should also be about solutions, like not only what am I dealing with, but what must we change in our government, in our industry, on our television sets, et cetera, to create a stronger caregiving system that centers workers. And what do workers need in their jobs? I think that those are critical. Yeah.
I do wonder, just because we are in a very interesting moment in terms of labor organization and unionization, and the, apparently, at least by polls, increasing support for unions, how you see, care workers and organization of care workers and mobilization kind of fitting into the current
just
context
in April
around unionization.
April 18th at Washington, we gathered about 400 care workers and some supporters in Washington at the first ever Care Workers Summit. And we heard from early childhood educators and child care workers, domestic workers, home care workers, all kinds of direct care workers, all together in one place. And there were such incredible, heroic organizing stories about people who really see this work as their calling and literally cannot pay the bills, cannot put food on their tables, cannot take care of their own families as care workers. And that's why they joined a union. And some of the unions in the care sector are some of the fastest growing unions in the entire economy, because this has been poverty wage work for so long. And it's also sectors of the economy that are growing, jobs that are not going to be outsourced. They're not going to be automated. No matter what you ask ChatGPT, it's not going to be able to take care of your loved one. And so these are jobs that are here to stay, and unions are on the front lines of fighting to make them good jobs for the future. And the kind of energy and dignity and power that we felt at the Care Workers Summit, I think, is a part of that same fire that we're feeling all over the country. And it is really about demanding an economy that allows us to have dignity and take care of the people that we love. And so, yeah, care workers are very much a part of that wave and that movement, and are going to be, I think, for the foreseeable future until these jobs become really good jobs, and maybe even after that.
If I can build on that, I mean, I think I follow a lot of the news coverage on kind of the worker mindset, so to speak, right? In the last few years, I think as we saw COVID take over and as people went remote, there does seem to be at least a bit of a shift, whether it's temporary or long term, about what should the workplace look like? What power do workers have at defining those standards? do I need to be in the office? What is so painful about a commute? Like, and and sometimes it's very often from a middle class perspective and not so much for people who don't have the luxury of working remotely. But it is, I do think for a lot of people who then, use their votes or get to decide, how a caregiving sector is funded and regulated and supported, it is changing the perspective a little bit on what is it that workers at any level need in this economy, and how can we restructure work to support people. Now, whether that's longstanding or it'll lead to the right things, I'm not sure, but it's interesting in that regard. The other piece I'll say is that I think as more workers organize, the resistance becomes stronger as well. And so in many cases, we are also seeing stories of industry leaders pushing back on organizing. And that tells us that we're in a battle. I mean, it's important for us to really be clear about what our standards are for job quality and workplace conditions and for workers' rights, at a time where people have a lot of money to lose if you're the CEO of a major franchise, right? And so I think that's just the reality of it as we move forward.
Yeah, and Ai-jen, you did mention about bringing together folks from the child care worker all the way, through the care work across the lifespan. And so I am interested in hearing from all of you, both sort of in the context of unionization, but also more broadly, the opportunities around having this shared narrative around care work and care workers, and what you see as potentially being really effective, or where the places that we can really mobilize to create a shared narrative in the future.
I think
and what
it's
your
really
experiences have been with
important that care workers are able to have a voice as workers in this part of the economy, in a sector that has been so devalued, where almost all of the marginalized people of the world are concentrated. You have young babies, you have people who are living with disabilities, you have older people, and then you have a whole bunch of women of marginalized social status working, and invisible caregivers who. So I just think it's really important that we have narrative frames that allow us to project power together. And care work and care workers, that's one of the reasons why the Care Workers Summit was such a huge breakthrough. Bringing all of those parts of the care workforce together to speak with one voice, to say, we are doing the work as professionals that makes it possible for every other part of the economy to function. And this is a sector that is equal in importance and value. We are often referred to as reproductive labor as opposed to productive labor. And the fact that we can just say, no, this is work, we are professionals, this is a job, and this is work that deserves respect and protections and fair compensation. And to do that with one voice, I think is absolutely necessary.
Yeah, during the pandemic, I feel like just sitting on the side of, a narrative change practitioner working on care for a few years before the pandemic, just sort of seeing the narrative, tiny narrative breakthrough that came with parents starting to sort of identify as caregivers alongside, care workers and people caring for older adults. There was something that happened in the narrative there where the power of the whole care ecosystem just like exponentially exploded. Of course, the numbers of people grew, but also there was a narrative power there that was really kind of, not surprising, but really exciting and important. And that's the kind of, because I think it, from just like places like TikTok and Instagram, just sort of seeing the responses to that was really interesting. It brought the parent caregiver conversation out of sort of its lane, expanded that energy into other lanes of care. And that was, it's a win-win, honestly, across the board, because there's nobody there was sort of doing well in the pandemic. And so, yeah, it was just like an example of collective narrative power that hopefully can lead to power overall. But I think to me, that was a clear indication of the benefits of talking about this from a narrative perspective, talking about this as one, and bringing together those voices and those stories, and then actually trying to reflect that in pop culture storytelling, where we can, not to sort of, the idea here is not to kind of obscure the details or the specificity of the experiences, but to kind of bring some of the systemic in, bring some of the solutions in. And that, I think, connecting the dots for care across the lifespan really kind of allows us to do that.
Yeah, I mean, I agree with all of that. I think that there's a lot of opportunity with the care work frame in multiple directions. And I also think it's just reflective of our realities. Like many of us are living lives where, we're supporting children and we're supporting older people and multi-generational lenses on how we live. If there is, at least one narrative that merits like unique attention from at least the older adult direct care space, I would say that we learned, especially in the first year of the COVID-19 pandemic, nursing homes were easily the most disproportionately impacted in that first year. Something like 1 in 2 deaths and then 1 in 3 deaths were in nursing homes. And I would say the two most common egregious narratives that we heard about the nursing home sector was one about older people, right? The residents being, of course, they were going to die in larger numbers. They were medically frail. That was just a natural reality. And the second piece, the nursing assistants were also impacted. And the argument was to say, well, these workers it's their fault. They're working more than one job. They're transmitting the virus from facility to facility, et cetera, right? And I do think when you step back and ask why did a pandemic on one level, why did it ravage nursing homes in particular, but why did we not take a moment to pause and say, what would a reformed nursing home system look like if that's what we want, like what would it look like? I think it has to do with deep ageism in our culture and ableism, right? This idea that nursing homes are home to older people, most all of whom have disabilities, and all of whom are low income. And those are some of our most neglected populations in this country. And I think as we think about care work, at least as it relates to older adults and nursing homes in particular, I think we should unpack a lot of the quite problematic assumptions we make about age and who matters in moments of crisis. I think we saw the worst of it in that first year. We still are, but in that first year, it was especially horrible.
Yeah.
Mm-hmm. That zero-sum thinking that became so prominent at that time was really unproductive and detrimental to the conversations that we were having. Absolutely. So I do actually have a question from one of our audience members, and it might be that Robert, this might be more applied to you because of your policy focus, but it was, would updating the federal job classifications help shift the narrative?
I think so. I mean, I can speak more to the direct care side of it. I'm not familiar with the classifications and the child care side of it, but they do need to be updated. I mean, they're quite outdated, decades old in some instances. And the clientele that direct care workers are supporting has become very different in the last few decades. I mean, we're seeing higher rates, higher acuity levels, higher rates of Alzheimer's and other forms of dementia, cardiovascular disease. We're seeing the first population to age with HIV and AIDS. We're also seeing the first large generation of people to age as out LGBTQ people and so much more. And so updating the occupational classifications to consider the needs of people today that rely on direct care workers to make it through the day is essential. There's also the need for new classifications that I think would raise important conversations about these workers. One is the need for an occupation on direct support professionals. These are home care workers who support people with intellectual and developmental disabilities. And I think that's a really powerful one because we don't have good data on those workers, thus we don't know to what extent people with IDD have adequate supports at home. And I think it's time for that. And it's time for us to have a conversation about people with intellectual and development disabilities, people with disabilities in general, both as consumers and as workers. I think there's potential there as well. Yeah.
Mm.
I think that's important and missing right now from the conversation. So we have about 4 minutes left, and I want to give you all time to bring up anything we haven't discussed before, or things that you think are really important that you want to highlight again before we end our conversation. And thank you. This has been a really rich, thoughtful
I just want to
discussion.
shout out the research. I think it's really terrific, and I'm glad we had a chance to talk about it and bring it to life in some ways. And I'll say for people who are on this call that sometimes we think of messaging research as only relevant to like industry leaders or activists or nonprofits. I use it all the time for personal conversations at the kitchen table, at gatherings and reunions. Like, it's so important for us to find
Great.
constructive, evidence-based ways of talking to each other, especially at a time of so much division. Yeah,
Yeah, I want that, and gratitude for the research, gratitude for the attention and focus on care and care work, and also for bringing us together for this conversation with these two incredible leaders who I admire and adore so much. Also, the thoughtfulness that goes into creating narrative research that actually changes the narrative. It's not easy. And I think all three of us know what goes into that, and are looking forward to building off of it.
Yeah, I can sort of echo that and close us out. And just I live for sort of research that we can take into our culture and narrative change work. And when I first heard that the work project as well as the culture change project were happening, it felt like a dream, because care was being centered in both. And just that is actually a testament to the movement. And it's just endlessly useful and actually very exciting. So thank you.
Yeah, this has been such as somebody who's worked on the project for the past 3 years, such an important and fascinating part of this work. And I'm glad we're continuing it as well, both as part of our culture change project, which is ongoing. And I believe we had some links dropped in, leading people to the hub for that, where we have a lot of reports and other information about care work, but also a project that we're currently working on more generally on reframing work and labor, of which care work that we're discussing now, but also care work across the lifespan is really becoming a central part of that. And so we're going to have more findings to bring into this and really integrate with the work that we've already done. But I do want to say thank you again to all of you. This is such a great conversation. I learned a lot. And just getting a chance to interact with the research we're doing, with all of the work that you all doing has been really, really helpful. So thank you so much for supporting this work and being part of this conversation.
You too.
Bye-bye.
It was great to see you all. Take care. Bye.